Before we begin today's formal presentation, I'd like to take a moment to review our objectives. Today we'll describe the state of mental health care in the United States and the role of pharmacists, discuss digital health tools and mental health care, and examine how pharmacists could use digital health tools to augment their roles in mental health care.
So this is actually a really big topic that I have a lot of difficulty with this because I work in the home healthcare setting and I'm really passionate about use of technology, and we're actually exploring how to use this. I would say for myself personally, with a low socioeconomic demographic that we have probably about 30% of our population ourselves suffer from serious mental illnesses. And when we look at this across the United States, we can see that 1 in 5 adults do have a mental illness, but only 2 in 5 are actually receiving treatment. And I'm not surprised by that, because if you think about it, there still is a stigma there. There's still some issues that face patients for this care, and there's huge barriers. And when we move beyond this, we also see that there's a conundrum facing us. We have a lack of psychiatrists that are basically be able to practice here soon. We're going to see a shortage. So for me, I often think that we really need this key idea of, like, how do we integrate, especially for us, pharmacists into mental health care teams. I mean, I get asked routinely about, medications, administration, what's good for patients and such, and there's a value there. And I think that with this upcoming shortage of psychiatrists in the United States, we really need to kind of think to ourselves, like, where is the role for pharmacists, and what can we do to help deliver that care, and where can we fit in that dynamic? Because at the end of the day, when we look at it, there's a large number of pharmacists out there, and we can step up to play a significant role. And the one thing I love about it is that there's actually a recent study that came out in JAMA, I want to say in the past 2 weeks, that highlighted that patients see more pharmacies than they actually see PCPs or anyone else, and that 90% of the US population lives within 5 miles of a pharmacy. So we're in a prime location, a prime subset to actually deliver mental health care. But the question becomes, like, how do we do this and how do we go about it?
And to complement what Dr. Aungst reviewed, in the landscape of care, when we see so many challenges and opportunities, treatment adherence specifically stands out. With such a complex, not only factor of care, but also behavior, something that makes all of us, and especially patients, truly human, are the challenges around how we affect those behaviors related to health. If we look at one of the many definitions here selected from the American Psychiatric Association, defining adherence as the ability of a patient to conform to a treatment regimen outlined by some practitioner or provider in healthcare, we can understand that there are so many factors that go into it. The challenge of not only the complexity of the behavior of adherence is the outcome of adherence. And to what Dr. Aungst had pointed out previously, the landscape of care, the millions of patients that we provide care for, is especially challenging when we see non-adherence resulting in outcomes such as hospitalization, drop off of treatment, and overall just negative outcomes that we're trying to actively solve and care for in our healthcare system. The numbers that we look towards number in the billions with a B when we think of the outcomes that are associated with treatment non-adherence. As we start to consider where tools, the nature of practice come together, it's really an important way that we can identify the category or the grouping of behaviors around adherence, and the category and grouping of solutions and tools that we'll identify as digital approaches.
Now, what you say that, and the one thing that comes to me is the fact that, there's a difficulty I face right now is that we have a large population with schizophrenia, for instance, and medication management was always key. We would have nurses go into a person's home and directly administer the medication. But now with the ongoing pandemic, and we have patients that are actually really scared. They don't want anyone coming to the house, but now they're not getting their antipsychotic. So how do we bridge that gap? And this is one thing that gets me, is like the whole adherence issue, the medication management, falling back on our traditional human aspects of how we integrate care. As you mentioned, I think this is a little bit troublesome because you throw like a wrench in the gears and it suddenly stops working. But I would say for psych, this is one of those conditions where, downstream effects can be very, very difficult if you just don't take your medications. And that's one thing that always gets me.
And as a complement to that, thank you for that point, Dr. Aungst. The unique challenge that I want to highlight, both in the slide and this conversation, the challenges of not only those inputs, how do we measure the behavior, but also the challenges on output. How do we know if someone is adherent? Not only in what actions have they taken, but also what are we looking for clinically? That's why identifying some of these outcomes that we can tie such large dollars to, but also large elements of quality of life, that's going to be one of those important things that we look for as potential solutions in digital approaches.
I would completely agree. That's definitely something that has to be considered. So when we think about that, then, the roles of pharmacists in mental health care, coming back to, this key point then that there's these outcomes that we have to consider. Where does a pharmacist fit into that play? Like, where do we see that we can play a benefit? Now, Dr. Patel, you and me are probably very up to date on the pharmacist patient care process. This came out, what, like about 2 years ago, would you say?
Yeah, it's been a topic that's been discussed for a while, but really being able to speak to specific points has been a more recent development.
Yeah, and it's kind of like I would say it's like a more formalized process in terms of us trying to, where can the pharmacist go into and what can they do? I mean, there's 5 points that they really key on. It's collect, assess, plan, implement, and follow up. So almost like a continuum of collection of information. And I think when you think about this with mental health, what you see is like collect, like what information do you need to collect about that patient's background, their health history and such, and then assess the clinical components. But to me, one of the things that also needs to be assessed, I think that never really gets too addressed in huge, is like things like social determinants of health, barriers to access of care and such, because that's going to impact how you develop a plan. And, for instance, if a patient's like not taking their medication, no matter what you do, it's not going to really, your plan's not going to be really, come to fruition. That part of the assessment is like, why aren't they doing something, or what can you do to help improve that? I think it's part of that screening mechanic. And I think that's really going to lead to whatever implementation you want to do to help that patient address their needs. I don't know, what else would you say is a key that you think with the pharmacist patient care plan that really like stands out to you?
I think to your point, Dr. Aungst, the care continuum is really a continuum. And in having to make more discrete measures that we can build solutions for, look towards both regulation and billing purposes, there are so many valuable outputs of being able to identify what collection looks like, what assessment looks like. But in truth, you and I both know that practice is very gray. For example, the follow-up tends to overlap with the plan, or when we're assessing, we're actually implementing a new pharmacotherapy. So I think the challenges and really the opportunity is being able to pull in multiple factors, apply some level of mass customization, which is almost contradictory to think of as we consider what the value of technology offers, and be able to talk to a very specific output or a metric that we can measure. Challenges that exist not only in pharmacy, but especially in mental care. I believe it's our former US Surgeon General, C. Everett Koop, who said, drugs don't work if you don't take them. So
Yes.
being able to speak to that and be able to hold on this really entire history of healthcare to say it's follow through. And that follow through is often messy. And as pharmacists, it's our challenge, our opportunity, our work to see that we actually see it through.
I think that's well said. I think that's probably the best way I think you could summarize these key things. I think it falls in almost all clinical areas, but we're talking about mental health, so I think that's probably something we should really focus too in terms of how that will develop out over time.
And as we consider what development of not only treatment adherence or care for mental health looks like over time, we have a wonderful complement when we look towards the constantly evolving nature of digital health. As pharmacists or anyone who interacts with pharmacy in any way in healthcare knows, it's an ever shifting field. Different medications, different treatment guidelines, different inputs into what we have resources for. The unique complement to this is that digital health is constantly evolving alongside, sometimes in spite of healthcare, and sometimes because of healthcare. And when we look at what changes in digital health, which is a very broad term, we see things like access to technology, not only on the provider side as a pharmacist, as prescribers like nurses, physicians, or even the access that patients have changing and growing, but also what these tools and the actual technology is capable of. So if we look towards what pharmacists can already use in our current landscape of healthcare, we can assess whether or not patients are using these kinds of digital tools like healthcare apps, or we can use the information that these apps are collecting, but also the complement when we have the devices, Wi-Fi or Bluetooth-enabled blood pressure cuffs, or blood glucose monitoring across a significant time period that's automatically sent. Somehow incorporating into care is a unique challenge that the pharmacist has to, going back to what we just discussed in that care process, intake data, contextualize it to relevant care in that patient, and be able to apply that to the times we live. And by example, if we look towards telepharmacy, with recent transition to so much virtual care, use of telepharmacy for not only following up with patients and getting some of those quantitative measures of things like anticoagulation or adherence, but also qualitative measures. How are these things working? What kind of side effects are you looking towards? And the extension beyond just the four walls of the clinic.